and welcome everybody to this Virtual Fields webinar. My name is Rachel Krug, and I'm the CEO of Virtual Fields. Virtual Fields is an exceptional eye exam experience with visual fields, color vision, and pupillometry exams in a comfortable, patient-friendly headset. And I'm joined today by the incredible Dr. Julie Poteet. Dr. Poteet, can you briefly introduce yourself and share your background in eye care and systemic health?
Thanks, Rachel, for having me on. I'm very excited to be here. And I do want to say I was at the American Optometric Association meeting last week in Nashville, and I did have a wonderful opportunity to visit your booth and try on your headset. And she did not ask me to say this, but it is really, for lack of a better term, it's cool. It's very cool. I'm excited about what you're going to bring to the industry. But my name is Julie Poteet. I am a residency trained optometrist. I did my ocular disease and primary care residencies at 2 VA hospitals in Boston. And while I was working with my veterans, I became interested in why some of my veterans seem to age so differently than others. I would have 65-year-olds walking in hunched over with canes, and then I would have 80-year-olds walking in with tan legs who'd been on the tennis court that morning. And it just made me so incredibly fascinated on, what environmental influences, what in our environment, what, lifestyle choices are influencing how we age. I then went on to complete a master's in human nutrition and functional medicine. And then I became a certified nutrition specialist, which is the highest certification level for a nutrition in nutrition for healthcare providers. And I was one of the first ODs to obtain that. I worked under my mentor, Dr. Stuart Richer, at the Ocular Wellness and Nutrition Society for 6 years. I was his vice president. And then I went on to be president for 3 years. And I just turned the presidency over to the wonderful Dr. Netta Joya, who we are so blessed to have at the helm. The Ocular Wellness and Nutrition Society is really the only professional society for eye care providers and anyone that's interested in ocular health and nutrition. So it is, it's a group of like-minded, passionate researchers, providers. We're kind of a bridge between what the research says and, clinical applications of that research. So that's my background.
Thank you for sharing that. So let's start with a brief overview. How does systemic health affect overall eye health?
So the eyes are end organs. Any disease, anything that affects the circulatory system, the neurological system, the immune system, everything it can affect the eyes. In fact, the retina is considered the window into systemic health, and I'll kind of expound on that in a bit.
Great. And can you explain how common systemic conditions like diabetes and hypertension impact the eyes?
Sure. So I've got some stats I want to talk about first. And I'm going to kind of read them because I don't want to misspeak. But these stats are alarming. More US adults are sick than healthy. Excuse me. 1 in 2 US adults has diabetes or prediabetes. 3 in 4 are overweight or obese. And only 1 in 15 US adults are metabolically healthy. The next few stats alarm me even more. Our kids are sick. 1 in 4 has, prediabetes. 1 in 4 are overweight or obese, and 1 in 6 have fatty liver disease. And again, our society cannot sustain this. I just had a patient that I've been following since he was 3, and he's 11 now. And mom told me they just got back from the pediatrician and had some alarming news. He's pre-diabetic and his liver numbers were off. 11 years old. Okay. 1 in 3 Medicare dollars is spent on type 2 diabetes. 1 in every 4 US healthcare dollars is spent on type 2 diabetes. Type 2 diabetes is a lifestyle disease. I'm not talking about type 1. Again, 1 in 2 US adults is pre-diabetic or diabetic. Diabetic retinopathy is one of the leading causes of blindness. Again, this is not sustainable. In 1960, only 5% of our GDP was spent on healthcare. Today, it's 20%. Again, this is not sustainable. Poor diet, poor lifestyle choices are driving just chronic systemic disease. And again, every chronic systemic disease affects ocular health.
Mm.
So.
Yep. Yep. And what are some common eye problems? You just mentioned diabetic retinopathy, but what are some others that are directly linked to systemic health issues?
Autoimmune disease, any kind of immune system dysfunction, vascular disease, neurological disease, macular degeneration. Some refer to it as Alzheimer's in the eye because the drusen that form in macular degeneration are composed of similar products that the beta amyloid plaques in Alzheimer's are composed of. Both represent chronic sustained inflammation. So.
Yep, that's helpful. How can a routine eye exam help detect underlying systemic health issues?
So, William Shakespeare said the eyes are the windows to your soul, but they are so much more than that. The eyes are the windows to vascular health. Problems spotted in the retina are often the first signs of disease lurking elsewhere in the body. As eye care professionals, we are profoundly spoiled with our technology. We have the ability to image the retina on every single patient we see. Takes a few minutes per patient. The neurosensory retina affords a unique setting for the characterization of systemic disease. It allows a direct, non-invasive, in vivo visualization of the microvascular circulation and central nervous system. And so we as eye care practitioners can do this on every patient. I use retinal photography as a teaching tool. I think if patients have a why behind something, they're more apt to make those lifestyle changes. So I show patients the microvascular changes and what they mean. And I educate them that they are early warning systems for what is happening elsewhere in the body. And so again, this wellness and prevention movement that I believe is gaining momentum in this country, eye doctors are perfectly poised to be on the forefront of that movement simply because of retinal photography. I had a patient this morning who was having intermittent blurry vision. I was talking to her about her blood sugar, was trying to determine the cause. And then we looked at her retina and there's microvascular changes consistent with hypertension. And I was speaking with her and she said, yeah, I'm having a hard time getting my blood pressure under control. I said, well, what are your numbers? Are you checking it at home? And we talked. And, we do know that for every 20-point increase in systolic blood pressure above 115 doubles the risk for heart attack and stroke. And so again, we as ODs, we as, OMDs, we can look at the retina on every patient and talk to patients about it. We know that diet, so diet is a huge driver in chronic sustained inflammation and hypertension. And I talk about diet with every single patient I do. And I use retinal photography as a teaching tool to do it. So.
What are some diet tips that you give, or diet and nutrition tips? And you started to talk about how that plays a role in maintaining good eye health, but could you go into a little bit more detail?
Sure. So everything that, I talk about, we talk about and we advocate for in the Ocular Wellness and Nutrition Society it has to be evidence-based. So, again, everything I talk about is based on, okay, what is the current evidence? And it does evolve and change. There was a study published in JAMA in 2017 that listed just 10 dietary factors to be the cause of nearly 1,000 deaths every day in the US from heart disease, stroke, and diabetes alone. And we know that heart disease, stroke, and diabetes affect eye health and affect vision. And so there's 10 factors. I'm just going to read them. Low nuts and seeds, low omega seafood, low omega-3 seafood, low vegetables, low fruits, low whole grains, low polyunsaturated fatty acids, high sodium, high processed meat, high sugar sweetened beverages, high red meats, unprocessed. And so my patient this morning, I talked to her about, high sodium in her diet, and so again, there is a movement in healthcare towards prevention and wellness. And I truly believe that eye doctors are perfectly poised to be at the forefront of that movement simply because our imaging technology. So we are the primary gatekeepers, primary care providers for eye care. And so, yeah, I think this should be a discussion we have with every patient.
That's
So,
great. And I mean, part of being able to have that discussion is just getting people in your office in the first place. So how can we help educate people on the importance of getting an eye exam so that they can have these conversations with you?
I think public health campaigns work beautifully. So um, yeah, I just
Yep. Yep. Awesome. And then how can eye care professionals educate their patients? You started to talk about this on managing systemic health for better eye health.
I do tell patients, again, I just kind of reiterate, I'm like a broken record all day. The eyes are the windows into systemic health. They're somewhat of the early warning systems, even for neurological health, because there's so much we can see in the retina. And, I talk to every patient about the macula, the central spot in the back of the eye that is responsible for fine detailed vision. And we know that diet is incredibly important for macular health. The carotenoids, the green leafy vegetables, lutein and zeaxanthin, also important for brain health. I had a mom today with a 6-week-old baby that she was nursing. And, I spoke to her about the macula and green leafy vegetables and lutein, and how lutein also deposits in the brain, and how babies have an even greater preferential uptake for lutein. Lutein is what gives breast milk that yellow color. So it's super important for brain health as well. So, and cognition. So yeah, it's, again, the eyes are part of the brain. So I embrace it.
That's
And
great.
yeah.
That's great. Are there any interesting case studies or studies where managing nutrition impacted eye health? I know you said you're very evidence-based. You shared some of the research, but curious if you could share more of it, or if managing a systemic condition in a different way, maybe not through nutrition, impacted eye health.
You know, so the better my patient's diabetes is managed by their endocrinologist, the less diabetic retinopathy I see, the less blindness from diabetes. And so, I always talk about their A1C. I always talk about their blood sugar, their fasting blood sugar. I talk about their vitamin D levels because we know that affects insulin sensitivity. But, I talk to patients. I had a patient, a type 2 diabetic, and I said, what does your endocrinologist tell you about food? And he looked at me, he said, Dr. Poteet, he said, if it tastes good, spit it out. Um, and I think we can do better than that. I think we can. And I think we are perfectly poised to do that, to start that dialogue. And I think that there should be, and there often is, a collaboration between different specialties. If we can carry on a contiguous message, and then I think it's patients are more apt to change. So
Great. We have a question from the audience. This is an interesting one. Does mental health have an impact on eye health and vice versa?
absolutely. I am kind of, my current obsession right now with nutrition is how nutrition impacts brain health. We know now that anxiety, depression have an inflammatory component. We know that the standard American diet greatly increases the risk of anxiety and depression. We know that mental illness increases cortisol in the body and inflammation, and everything is tied together. And that's the beauty of functional medicine. Everything's tied together. And one system affects the other. So I look at a patient holistically, and I treat patients holistically. And so often when you treat their nutritional intake and improve their diet through, anti-inflammatory diet, their mental health symptoms improve. And you know it. I mean, when like personally, when I eat horribly, I just don't feel good the next day. I just don't. So everything is tied together, and that is the beauty of nutrients and looking at, everything holistically. So.
Yeah, thank you. And then another question popped in, and feel free to put your questions in the Q&A. From an attendee, are there any common misconceptions that you encounter with patients? It's a great question. Thank you for.
I don't think we have we could probably talk 4 hours about that. The the nutrition world, the supplement world, I should say the supplement world, it's kind of the wild, wild west. I mean, there's so much hype and erroneous data out there. I think it's up to we practitioners to know what the science says. There is, I'm going to say, omega-3s, for example, there is a lot of conflicting data, and, it's confusing for patients. It's confusing for practitioners. But at the end of the day, we have to look at the evidence and be transparent with our patients. I think that the diet world in general, I have a lot of patients come in, and, I do have extra degrees in nutrition, and I understand ketosis. I understand a ketogenic diet. I understand. But I have a patient the other day who told me he just eats meat. He just eats meat and eats a lot of fat, and that's all he eats. And I'm thinking, wow, his risk of cancer is really elevated. No polyphenols, no vegetables, no fruits in his diet. I don't even want to look at his inflammatory markers. The cool thing about nutrition, every patient's different. The Ocular Wellness and Nutrition Society has partnered with the American Nutrition Association to afford eye doctors a path to become certified in personalized nutrition. And, it's really important because, again, every patient's different. Ketogenic diet is a medically tailored diet that really is efficacious for seizures and for certain things. But we have a lot of people that just don't do it right, and end up creating so much more inflammation in the body, and it's kind of scary.
Yeah. There's one more question here from an attendee. Is there potential for gene therapy in treating eye diseases that are commonly linked to systemic health issues?
Always. I think we're kind of we're just scratching the surface there, but I'm excited to see where it's going to go. Absolutely. Yeah. Especially for retinal diseases. So
Sure. Any recent advancements in diagnosing and treating eye conditions related to systemic health?
So I just had the honor of speaking at the American Optometric Association on a novel nutraceutical combination that the data on it is probably more impressive to me than any data on any therapy for dry eyes I've seen. Dry eye is a chronic inflammatory condition. Poor diet is one of the leading causes of dry eye. It largely impacts quality of life. And this novel combination nutraceutical blend has per the randomized controlled trials, shows a normalization in MMP9 levels, which is the inflammatory marker on the front of the eye, within 56 days. And again, steroids don't even do that. So I'm excited to see a nutraceutical which works. Again, nutraceuticals are cool because they don't just work locally, they work throughout the whole body. And this nutraceutical had that much of an impact on inflammation in the ocular surface. And yeah, I'm excited to see where this is going to go. I think this is going to revolutionize dry eye therapy. So
very exciting. Thank you for sharing that. And the last question, what do you see as future trends in the intersection of systemic health and eye health?
I'll tell you what I see. I see the students, the optometry students, I call them kind of the whole food generations, the younger ODs. They are the ones that are extremely excited about embracing the food as medicine, prevention and wellness movement. And, I see a change in our thinking in healthcare. Tufts just opened the first Food as Medicine Institute. So I see a change in healthcare. And I think that as we as a profession don't embrace it and don't embrace our role as, the gatekeepers and, kind of being on the forefront of prevention and wellness, then we're doing a disservice to our patients. At the end of the day, every patient I see, in the back of my mind is, have I done everything I can for this patient? And if I haven't discussed nutrition and wellness, with my patients, I haven't done everything I can. So
That's amazing. Thank you so much for your time, Dr. Poteet. We really appreciate it. And thank you everybody for attending. It was great to have you. And we will see you next time.
thank
Bye.
you, Rachel. Thanks. Bye-bye.